Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I'm here to talk about orthostatic hypotension, a very common but often undiagnosed medical problem. Orthostatic hypotension is a condition in which blood pressure drops when going from lying to sitting or from going from sitting to standing. Ordinarily, when a man goes from lying to sitting or lying to standing, blood pressure doesn't change. Our autonomic nervous system adjusts to our movements to maintain blood pressures in the body, especially to the heart and brain. There are some large veins in the abdomen, pelvis, and legs. In fact, they can actually hold up to 2.5 quarts of blood when someone is standing. When people stand up, the veins in the abdomen, pelvis, and legs tighten up and prevent the pooling of blood, so the blood flow back to the heart is maintained. This is important because the heart must receive blood from the veins to be able to pump it across the lungs to get to the other side of the heart, where oxygenated blood is then pumped to the body. But in people with orthostatic hypotension, blood will pool excessively in the veins of the body when standing up, so the flow of blood back to the heart is limited. When this occurs, the amount of blood flow out of the heart drops and blood pressure falls additionally. And if the blood pressure falls excessively, people can get dizzy, lightheaded, or even lose consciousness. So when I see patients complaining of feeling woozy, the two main clinical issues that make me think of orthostatic hypotension are, number one, people experiencing problems with lightheadedness, fainting, even passing out. The second thing I think of is people who have trouble controlling hypertension, that is, their high blood pressure. For some reason, people with orthostatic hypotension tend to have blood pressures that fluctuate more than usual, which can bring on yet another problem associated with orthostatic hypotension. And that is when people are lying flat, their blood pressure can become excessively high, causing damage to the heart, brain, kidneys, and internal organs. To make a diagnosis of orthostatic hypotension, I have a person lie flat for a few minutes and then take their blood pressure.
Then he had Daddy sit up straight on the table and he took his blood pressure again. And each time it was dropping. And then he had him stand up, took the blood pressure again, and it dropped again. So that's when he diagnosed it.
Normally there should be less than a 5 millimeter of mercury drop in systolic blood pressure when going from lying to standing. And sometimes it is even normal for systolic blood pressures to increase by 5 to 10 millimeters of mercury. What is the best therapy for orthostatic hypotension? In most people with this condition, one simple maneuver fixes the problem and does so within a week. What is it? Raise the head of the bed anywhere from 3 to 9 inches. Raise the head of the bed. That doesn't mean to raise the level of your head on pillows. That may help for stomach acid reflux, but it will not work for orthostatic hypotension. Nor will a medical bed, commonly known as a hospital bed, in which the feet or head can be heightened or lowered. The best therapy for orthostatic hypotension is to raise the head of the bed. And the most inexpensive way to do this is to use bricks or cinder blocks under each of the 2 bedposts at the head of the bed.
I remember thinking that sounded pretty weird.
There are other products designed to help you accomplish this, because to really help this condition, the head must be higher than the neck must be higher than the chest must be higher than the abdomen must be higher than the pelvis must be higher than the thighs, and the thighs must be higher than the legs and feet.
After a few times like that, you realize things are a little different, somewhat improved.
When he came for his next follow-up with Dr. Whitney, his blood pressure was fine.
Try it. If it doesn't work, come back and see me, and we'll try other treatments.
We've never changed it. it's still just the bricks under his headboard. It worked.
I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.